Bismillahirrahmanirrahim. Dear students, welcome to my lecture number 41. Today the topic which I am going to present that is anti-arrhythmic drugs. So first of all, I would like to introduce about the cardiac arrhythmias. So what is cardiac arrhythmia? Cardiac arrhythmia is the disorder and the rate and rhythm of the cardiac contraction due to myocardial damage is known as cardiac arrhythmia. In simple words, you can say when there is abnormal heart beatings, whenever there is a myocardial damage or the disorder in the rate and rhythm of the cardiac contractions, the cardiac arrhythmia consists of cardiac depolarization that deviates from the normal in one or more aspects. In cardiac arrhythmia, there will be abnormality at the site of origin of impulses and its rate and regularity and its conductions. It means that the heart beatings, the normal heart beatings, so they are not maintained. So those drugs which are used in the treatment of abnormal condition like myocardial damage and cardiac arrhythmia, that is called anti-arrhythmic drugs. According to Vaughan-Williams classifications, anti-arrhythmic drugs has been classified into different categories. So the class 1 is sodium channel blockers. So and this group include quinidines, procainamides and disopyramides. Its pharmacological classification is pharmacologically these drugs actually these are membrane stabilizing actions. These drugs cause prolongation of the refractory period, and these drugs also cause prolonged the action potentials. In group B, the drug includes in group B, that is lidocaine, maxilitine, and tocanides, phenytoin. These are also called membrane stabilizing actions. So these drugs can also shortens the refractory period, and these drugs also shorten the action potentials. While in group C include placanides, acanides. So these drugs cause membrane stabilizing action, and there is no action on the action potentials. And class 2 drugs, beta blockers, which are called counteracts, these drugs can counteract the catecholamine productions. So these drugs include propanolol, atenolol, metoprolol, and sertolols. These drugs can eliminating the sinoarterial firings, as well as these drugs decrease the contractility and increase the atrioventricular refractoriness. In class 3 drugs, these are also called repolarization prolongings. So these are the drugs which cause repolarization, that is amidarones, bretyliums. So these drugs prolongs the refractory periods, and they can also prolong the action potential as well as to prevent the re-entry rhythms. Class 4 drugs, these are calcium channel blockers, and these drugs include verapamil, diltiazem, and it inhibit the slow calcium channel and depress the contractility of atrioventricular node. Quinidine is anti-arrhythmic drugs. So it is a class 1 anti-arrhythmic drug. So it is an optical isomer of quinine, anti-malarial drugs. The pharmacokinetic profile of quinidine. So quinidine is orally active, and it can be given to the patient in the form of injections, IV in emergency, as well as IM, but this is painful. Almost 80% quinidine is bound to the plasma membrane, and its half-life is 4 to 6 hours. It means that the time which is required for this drug, so the time which is required for quinidine, that is 4 to 6 hours. and with the peak plasma concentration to be achieved 50% half of its original concentrations. These drugs can be metabolized by the liver 75%, as we have already discussed that all the drugs must be metabolized in the liver before it's reaching to its systemic circulations. Its excretion is unchanged fraction by kidney. Pharmacological action of quinidines, they can direct the direct effect on the cardiac tissue, so it can reduce the inotropic, it can reduce the excitability, a reduction of, you can say, conductivity, and prolong the refractory periods, and it can also relax the tachycardia. The other actions, quinidine, so it's another pharmacological action. These are also act as an anti-malarial agent, as an antipyretic agent, and it can also decrease the blood pressure by causing vasodilatations. The adverse effects which are reported after administration of quinidine, so heart blockage may be occurs, sinus arrest, myocardial infarctions, depressions, and QT prolongations, ventricular fibrillation may be occur, nausea, vomitings, and diarrhea, rashes, and edema. So these are also reported. Let's suppose if overdosing of quinidine occurs. So these are the adverse effects which are reported. The clinical indication of quinidine, so they are used as an antiarrhythmic use, so they are used in the management of arterial flutters and fibrillations. They are also used in the management of ventricular fibrillation and flutters, as well as they are also used in the management of paroxysmal supraventricular tachycardia, as well as they are used in the treatment of premature supraventricular tachycardia, and many more conditions like atrial, nodal, and ventricular premature deaths. They are also used as an anti-malaria, as an antipyretic, and especially they are also used during digitalis therapy. As we know that digitalis lenata, digoxin, so this is a drug of choice for CHF, congestive heart failures. Synchronisms, they are also occur due to overdosing of especially quinines. There may be chances of headache, vertigo, blurred vision, and tinnitus may be occur. Contraindications, so quinine जो है they are contraindicated in quinidine intolerance, as well as they cannot be used especially in digitalis intoxications when digitalis intoxication is occur, as well as they cannot be used especially in heart failures. They are also not recommended for hypertension and hypokalemia. Propranolol is an anti-arrhythmic drug, so as we know that this drug can block the beta receptor in the heart, thereby exert the negative inotropic effect, the negative chronotropic effect, and depress the atrioventricular conduction and depress the automaticity. So I have already explained about the beta blockers, that what is beta 1, what is adrenoceptors, and as we know that beta 1 is the most dominant receptor which is present in the hearts. What is the inotropic effect and chronotropic effect, force of contraction and relaxation. So I have already discussed these things in details, that the drugs which can directly act upon the cardiovascular system. So I think so please review lecture number 32. So I have already explained about the inotropic and chronotropic effect. It has anti-arrhythmic effect, as well as antihypertensive effect, and as well as anti-anginal effect in the cardiovascular system. Now come to another drug that is called lignocaine. So lignocaine is a local anesthetic agent. It can terminate the arrhythmia if quinidine failed. In case of failure of quinidine, so this lignocaine is used, so it can also eliminate the terminate the arrhythmia, but it can be given to the patients in the form of parenteral administration, intravenous or IM. The clinical use of lignocaine, so they are used as a local anesthetic, as an antiarrhythmics. The mechanism of action of anti-arrhythmic effect of lignocaine, so it is a membrane stabilizing effect. It can block the both activated and inactivated sodium channels, which in turn suppress the sinoarterial node and also ectopic beats. If you remember in my lectures regarding various drugs which are used especially during anesthetic conditions, stages of anesthesia, so I have already explained these things in my previous lectures. So please you can review all my lectures. So that is available on YouTube. So it can shorten the refractory periods and action potential, make the uniform rhythm. The adverse effects which are reported after administration of lignocaine, it may be in the form of bradycardia, hypertensions, or dizziness may be occur, blurred vision, sleepiness, confusion, and convulsions. So they are reported. This was all about the anti-arrhythmic drugs, and there are various drugs which are used in the treatment of whenever the heart beating had become abnormal and had become unable to control. So these drugs are used. And thank you so much for watching my lecture, and inshallah then I will further continue my lectures. Wish you all the best.